11. Headaches in pregnancy. Headaches in pregnant women are usually caused by hormones. Headaches can get worse in the first few weeks of pregnancy, but they usually improve or stop completely during the last 6 months. They do not harm the baby, but they can be uncomfortable for the pregnant woman. Lifestyle changes can help to prevent headaches. Try to get more regular rest. 12. Indigestion and heartburn. Indigestion, dyspepsia, in pregnancy is partly caused by hormonal changes and in later pregnancy by the growing womb pressing on your stomach. As many as 8 women out of 10 women experience indigestion at some point during their pregnancy. The symptoms of indigestion can include feeling full, feeling sick or nauseous and burping. The symptoms usually come on after eating food. You can ease the discomfort of indigestion and heartburn by making changes to your diet and lifestyle. 13. Itching in pregnancy. Mild itching is common in pregnancy because of the increased blood supply to the skin. Mild itching is usually nothing to worry about, but if it gets severe, it can be a sign of a liver condition called obstetric cholestasis. Mild itching could be prevented by wearing loose clothing. Avoiding synthetic materials and going for natural ones such as cotton helps. 14. Morning sickness and nausea. Nausea and vomiting in pregnancy are very common in the early week of pregnancy. It usually clears up at around 12 to 14 weeks, and it is harmless to the baby. In 9 out of 10 women, symptoms disappear by the 3rd month of pregnancy. About 50% of pregnant women have nausea without vomiting. 15. Nose bleeding in pregnancy. Nosebleeds are quite common in pregnancy because of hormonal changes. They are usually short but can be quite heavy. They can usually be treated at home. 16. Stretch marks in pregnancy. Stretch marks are narrow pink or purplish streak-like lines that can develop on the surface of the skin. Stretch mark affects up to 80% of pregnant women. Whether or not you get a stretch mark depends on your skin type. They fade after the baby is born but rarely go away completely. Massaging the skin possibly help to prevent stretch mark. 17. Leaking from nipple. Some women notice leaking from their nipple during pregnancy, and this is normal. In pregnancy, the breast may start to produce milk weeks or months before the due date. If your nipples are leaking, it is colostrums, the first milk from your breast in preparation for feeding your baby. 18. Vaginal discharge in pregnancy. All women, whether they are pregnant or not, have some vaginal discharge starting a year or 2 before puberty and ending after the menopause. During pregnancy, the cervix and vaginal get softer and discharge increases to help prevent any infection from traveling up from the vagina to the womb. 19. Pregnancy-induced hypertension. During pregnancy, your blood pressure will be checked at every antenatal appointment. This is because a rise in blood pressure can be the first sign of preeclampsia. Pregnancy-induced hypertension can run in families and affect around 10% of pregnancies. It is life-threatening for both mother and baby if left untreated. 20. Sleeplessness and tiredness in pregnancy. It is common to feel tired or even exhausted during pregnancy, especially in the first 12 weeks. Hormonal changes in your body at this time can make you feel tired, nauseous and emotional. The only answer is to try and rest as much as possible. Eat healthily and get plenty of rest and sleep. The tiredness could be due to the extra weight you are carrying. Again, plenty of rest is the antidote. Sleeping on your side can be more comfortable. You can support your bump with more pillows with a pillow between your knees.